What current options are there for hormone replacement therapy that we can speak to?
Oh, good question. Um, so your ovaries make three hormones: estrogen, progesterone, and testosterone. We'll talk mostly about estrogen and progesterone because those are the big ones. And estrogen really is the biggest one.
Mm.
Estrogen is what protects against heart disease, brain function, like cognitive function. It's what maintains bone strength. It's what regulates your mood. If you are having hot flashes and dry, or vaginal dryness, it's what's going to fix it. So estrogen is like the big one.
Okay.
Progesterone is used because if you have a uterus, like you haven't had a hysterectomy, and you don't have an IUD, because if you had an IUD, you wouldn't need progesterone. So if you have a uterus and you don't have an IUD, you need progesterone to balance your estrogen. Because if
Okay.
you just did estrogen without the balancing progesterone, the uterine lining would overgrow and you would be at high risk for uterine cancer. So those are kind of how the two hormones work. Estrogen is like your big bang for your buck. Progesterone is absolutely needed from safety's sake.
Okay.
It does a little bit for sleep a lot of the time. Testosterone sometimes the cherry on top for energy and libido, but not everyone needs testosterone. So, what are the options? So, estrogen is either a pill or through
Hmm.
the skin. And if it's
Okay.
through the skin, it's in like a patch or a gel or even like a vaginal ring that could get absorbed
Okay.
vaginally. But patches and gels are probably the most common, or pill. Progesterone, some compounding places will do through a cream. What we know is that progesterone's like a really big molecule that isn't absorbed well through the skin, and you may not be having like the safety benefit that you need when you do it through the skin. So my practice would only be to do progesterone orally. Now, there's some
Okay.
creative things you can do with progesterone pills, but generally progesterone in a pill, estrogen through the skin, through a patch or gel, or through a pill. The big important thing is when estrogen's done through the skin, that little risk of blood clots that you have when you take it through the pill is way reduced. So
Okay.
I strongly prefer estrogen through a patch or a gel and progesterone through a pill. And that's kind of like the safe way to do it, I think.